One of the areas that I think it's so important for physicians to know for patients with ovarian cancer is the need for testing. And I said ovarian cancer, but this is broad, right? Ovarian, tubal, and peritoneal cancer we kind of lump together.
Okay.
So in your situation, you probably remembered we talked about genetic testing very early on in the course.
Yeah, I think we did my genetic testing probably a week after I met you.
Right, and that's how we knew you
right
were
before my surgery.
BRCA1 positive. And there's so many different reasons to get the testing. At that point in time, there wasn't a PARP inhibitor that had been approved for treatment in ovarian cancer for maintenance therapy. And that was 2014 when you were diagnosed, and olaparib was approved that year for a treatment indication.
Okay.
So just going back and talking a little bit more about genetic testing, there's so many women that don't get tested. And it's so important, I think physicians really need to know about the need for testing all women with an epithelial, ovarian, tubal, or peritoneal cancer and the different platforms that are available. In your situation, you're at Duke. We're so lucky we have genetic counselors that are right down the door, so literally right down the hall from me, right? So they can do your counseling with you and talk to you about the different tests that you can get. And they probably counseled you about just doing the BRCA1 or 2 mutation test or this bigger panel of testing.
Yeah, it was the BRCA1.
But that was your test that was positive?
Yeah, that was my positive, yeah.
Do you remember what kind of test you had? Was it one of the larger panel tests?
I think it was one of the larger panels. I had a huge booklet, so.
Was it overwhelming to go through that process for you?
Not really. The woman that explained everything to me, she was very good at explaining doctor speak, I guess you could say. So yeah, I had no problem.
So one of the things that people talk about is, well, if you just test for BRCA1 or 2, you're going to miss these other tumors. But if you do these bigger panel tests, you may just get a lot of variants of uncertain significance. You don't know what they mean.
Oh, yeah, okay.
Which may cause a lot of anxiety. And so there's pros and cons to each approach. I really think that having the most information is the best.
It's beneficial for your survival. I mean, yeah, I'm glad I found out.
But having the larger panel test gives you more information about all these different genes that you were tested on, and there's a whole bunch of different panels. I don't think there's one panel that's better than the other, but I would just say it's really important for physicians to have that conversation with their patient. They can do point-of-care testing. They can do it from the office if they don't have access to a genetic counselor, just because I worry about people missing that opportunity to get tested and find out. You talked about you get information about your prognosis, but you also get information that could indicate that you could get one of these drugs, the PARP inhibitors, and you get information that can help other family members, because if you're test positive, then you can talk to your family about getting tested. And I know in your situation you have 2 daughters, and they both got tested, and
they're
negative,
both negative, yeah.
Which is great news. One of the issues that I get asked from medical oncologists is someone's had genetic testing, it's negative, now they have recurrent ovarian cancer, they can possibly get one of these PARP inhibitors for maintenance treatment. And what tests do you get and when?
A lot of questions.
We didn't really have to talk about this because we already knew in your situation. But I have some patients that don't have the germline mutation, and there's actually 2 tests that they can order that's available. We talked about them in the context of clinical trials because the NOVA study used the Myriad test for homologous recombination defects. There's also a companion diagnostic test for Myriad to evaluate just for BRCA mutations and the germline mutation, or now even the somatic. And then there's a foundation focus test as well for germline and somatic BRCA mutations. So if they have a patient who doesn't have the germline mutation, there's still these other testing platforms they could use to identify if their patient may be a candidate. So I think it's really important. Patients need to ask about that, right?
They do, yeah.
And physicians need to be aware about these different platforms for testing.